Hi. Hi, 1, 2, 3, check, check. Are we good to go? Hi, hello. Can you hear me? 1, 2, 3. Can you see me well? Hello. Hi, Miss Pooja. All right, great. So I believe people are joining in. We'll start in a minute's time. Great. So it's good to hear that everyone can listen to me. I think we'll just wait for a few people to join in and say another minute and we can start. If that's all right, please let me know. All right. So I think, fine, great. Good evening, everyone. Good evening, Team Lajja, and to all the beautiful women out there. I'm Dr. Kunal Patel, and we are going to talk on the Tuesday evening talk between 8 to 9 on today's topic selected as osteoporosis, the silent killer. I am Dr. Kunal Patel, an orthopedic surgeon practicing in Mumbai. And the reason we have chosen osteoporosis as a topic, because it is one of the slowly creeping disease, which people don't realize that it's a gradually progressive problem. And as a result of which people will have morbidities and mortalities, which will come suddenly. Now, osteoporosis is a disease that usually comes causing brittle and fragile, and it causes increased weakness of the bones, and as a result of which you can easily break your bones. So till osteoporosis is not there, you will never have any pain. As osteoporosis increases, the brittleness, the weakness of the bones increases, bone pains start. But the real devil is when the fracture comes. is when you start breaking your bones. The weaker your bones, the more the probability of you fracturing your bones. And as a result of which, pain, stress, financial issues, they start creeping in. It's a silent disease that does not cause pain until the bone really breaks well. Osteoporosis is likely to cause more fractures in the spine, the hips, the wrist, and leading to hospitalization, loss of independent living, causing deformities, pain in the back. It causes weakness. हड्डियों को खोखला कर लेता है. The example is comparing the construction of two different type of builders. One is a builder which is similar to L&T, Larsen and Toubro, making wonderful constructed bridges, tall buildings, and they never fall. And one is a shabby builder where the construction quality is poor, the quality of cement is poor, and as a result of which the bones are fragile, the buildings are fragile, they can fall anytime. We see many buildings falling down, and as a result of which we see loss of life. Similarly, the more fragile your bones are, the chance of it falling, causing fractures increase and खोखला हो जाता है हड्डी. The prevalence is so high that above the age of 50, American studies say 1 out of 2 women will have osteoporosis and 1 out of 4 men will have osteoporosis. And it is one of the major threats in about 44 million Americans, that is above the age of 50 years. It can affect any age, but increases with increasing age. If I would take a total pool of 100 patients of osteoporosis, 80 of them are women, be it due to ethnicity, be it due to hormonal reasons, be it genetic, but women are the most afflicted lot, unfortunately. The significance of osteoporosis in women is so high that if I would compare different diseases with osteoporosis related problems, for example, if I would say on an average in America, there are 370,000 heart attacks, 425,000 paralytic stroke attacks, 182,000 breast cancer patients. But if I would compare them with osteoporosis fractures of hip, wrist, pelvis, vertebrae, which is the spine, that totals to 14,56,000, which is more than the combined problem of heart attack, stroke, and breast cancer. So we have to realize the problem is grave because we are always focusing more and more towards heart attacks and paralytic strokes and other cancer diseases. Whereas the real cost of living, the debilitating conditions that arise, increase when more and more people are housebound. Financial losses come in, and as a result of which, people do not have access to good health care. People are more and more dependent on relatives. People are financially lost out on due to being retired due to fractures. So it is a cumulative effect, and that's why it is important to know about osteoporosis equally, if not less, than heart attacks, strokes, and cancers. Now, why am I saying it is important? Because osteoporosis is one, identifiable. It's not a sudden thing. You can test it out. Two, it's a modifiable disease. Means it is not something where you can completely let it go. There are medicines which are there. There are modifiable factors which are there, which can rectify the pace at which osteoporosis will set in into your body. So it's equally important to understand the problem early and start taking steps so that you don't have a problem later. So coming to the consequences, is already we spoke about various fractures that happen, and you lose your independence. You slowly start becoming wheelchair bound or walker bound or stick bound, and nobody likes to be staying back at home, is it? If I would ask any auntie that you have to be staying in bed or you don't have to move around, nobody would like it. They will feel depressed and they will feel useless about themselves. Fast forward yourself 40 years from now, 30 years from now. Would you be liked to be kept back at home and everyone from your family going out for dinners? Would you be liked to be pushed on a wheelchair or used to move around with a walker? Absolutely no. I don't think anyone over here would agree to that. So we have to start taking steps so that we don't have to get into that situation and ask for help from our grandchildren. The symptoms, people usually cannot feel their bones getting weaker. They never feel. They usually have the major issues coming up when they break a bone. Maybe due to a trivial fall, slipping, sneezing, jerking. So most of the patients are postmenopausal women where there is relative loss or reduction in the hormone known as estrogen, and as a result of which there is reduction in the bone strength in women. And these postmenopausal women are most susceptible to posture, drooping, and fractures when they fall. So if you are 35 to 40, you should set your alarm bells on now, because now you're going to have hormonal changes coming in. And as a result of which, you will have to start taking steps in terms of your diet, in terms of your lifestyle, in terms of exercises, so that you don't have early osteoporosis setting into your body. We need to procrastinate the problem. We need to push the problem away. Now, how do we test it? We test it by something known as bone mineral density, by various conditions known as various tests known as DEXA scan or QCT scan. These help in helping us in finding out the strength of your bone quality. The strength of your bone quality determines as to how much risk probability is there with you having the same kind of a fall versus a younger patient. So this is by the score known as T score. A T score would compare your test in a BMD versus someone who is younger, say around the age of 20, when the peak bone strength of your body is the strongest. So if your score is 0 to -1, you're normal. If you have a score of -1 to -2.5, it is slightly brittle, something that you need to really check upon, and that condition is known as osteopenia, the lesser evil of osteoporosis. And when you have a score of -2.5, man, the alarms have rung. You need to really get your work moving on. Start taking medicines to improve your bone score, doing workout, improve your diet, especially rich in terms of calcium, vitamin D, protein, and all. So what are the risk factors that increases the chance of osteoporosis? Anyone who is increasing age, female, Aryan race. So Caucasians or Europeans and Africans are stronger in terms of bone quality compared to Indians, the Aryan race. Then low BMI, people with less body weight. Then people with previous history of fractures. Any patient who has had any medical reasons of using steroids. There are various rheumatoid conditions or autoimmune conditions where a doctor has to prescribe you steroids. With steroid intake, the chance of you going into osteoporosis, the rate at which it happens increases. So all people who are on steroid tablets, make sure you're taking calcium supplements quite regularly. The other evil is smoking and alcohol. Smoking and alcohol increases the rate at which osteoporosis sets in. The other fragile group are people with autoimmune conditions like inflammatory bowel disease, and rheumatoid arthritis. I'll not get into that your doctor will make a diagnosis about it. Also, type 1 diabetes. Diabetics, you need to be very sure that you keep check on your bones, because when a diabetes patient goes to their diabetologist, they only focus more on their sugar levels, the eyes, the kidneys, and the nerves. But I have never seen any diabetologist speaking about taking calcium for your bones. So every diabetologist make sure that they prescribe calcium tablets to your patients, and every diabetes patients make sure that you ask your diabetologist to add a calcium tablet if required. Lastly, thyroid. Every hypothyroid patient should be having calcium tablet along with their thyroid tablets in a day. So if you're taking thyroid tablets empty stomach in the morning, make sure you're taking your calcium tablets at least one time during the day, so that you don't have increased chance of osteoporosis. So besides the BMD score, QCT score, there are various other tests which are there in blood tests, which your doctor would recommend, and they would decide upon which is the perfect test for you. They're expensive, so I would ask that let it be best judged by a doctor. Now, how to prevent it? Preventing fractures can be by preventing all the possibilities of slipping and falling down, especially old patients. When they go in the night to the bathroom, there are dimmed lights and they don't want to disturb others inside the house. So they just get up and they start moving to the washroom. And that is the most dangerous time when people fall, especially early morning, when you're half asleep and you get up, you slip, you fall in the bathroom. So you should keep low lit lights, especially in the bedroom and near the bathroom, so that you are able to visualize. You should not wear sandals or slippers without a good undersurface inside the house. You should always have toilet handles and supports, because when you want to get up and if there is a slippery surface, there is something to hold inside the washroom, you'll not fall down. And make sure that there are no telephone lines and raw cords which are there in the middle of the path, which will make you fall down. I would suggest that everyone should have those night lamps kept inside the house, so that they can see what's going around underneath the wires and everything, and they don't fall. Now, coming to the treatment of osteoporosis. Treatment of osteoporosis, most important, are three parts: nutrition, exercise, and medication. Nutrition is in your hands. How much ever we tell to the patients, they are usually following it for, say, a month or two, and they go back to their old habits. So make sure that it is rigidly followed. Now, what do I mean by nutrition? A bone is essentially made not just of calcium, but protein, vitamin D, and collagen. Now, collagen is one of the fiber structures that help keeping the calcium bound together. And collagen is made along by vitamin C, which is the least spoken about. So I would especially encourage every one of you to have more of citrus fruits, avla, limbu in their diet. All my Gujju patients have a problem with khatta khana. Khatta khane se haddiyan pain hota hai. Please don't get into that trap. The khatta khana which I discourage is the one which would cause joint pains, are the ones which are artificially fermented food or vinegar or pickles. Those are the ones which might cause you joint pain. But you should be using more of citrus fruits and lemon and avla. High protein diet. Now, all my vegetarian patients, mind you, are more prone to low protein diet, because pulses are the second class protein. So you need to make sure that you compensate by having good amount of pulses, say about 5 times a week, in terms of dal or rajma or chole or whatever. But you need to have good protein diet. Calcium. Now, calcium is a big list. People they should be having at least 1.5 glass of milk every day, or 3 glasses of buttermilk every day, or you should have other nutritional products which have foodstuffs which will have with high amount of calcium. For example, drumsticks, pomegranate, fenugreek, and these are vegetarian sources. Nuts, non-vegetarian sources are more of seafood, fish, chicken. They are high in terms of calcium. Prawns. So I would encourage all non-vegetarians to continue their diet, but less of oil. I don't want the heart doctors to earn more money because of high cholesterol. And all patients who are vegetarians to take at least 1.5 glass of milk. And if you don't like 1.5 glass of milk, at least take 3 glasses of buttermilk. So that's the reason there are less Kachis and less Punjabis in my OPD, because they are having more dietary intake of buttermilk in their diet. Second is exercise. Now, what exercise are we going to talk about? Exercise in the form of light aerobics. You can do it swimming, you can do gymnastics, but depending upon your age, I don't want you to fall and cause a fracture. And also low grade weight training. So you should be having dumbbells, at least say about 2.5 to 3 kgs to do your workouts, upper body, if you're doing at home. If you have a cycle, stationary cycle, or at home, you can use that. Or at least 45 minutes of walking around would do the minimum, meet the minimum criteria of exercise. Medications are the last important thing. Medications in the form of bisphosphonates and calcitonin and estrogen therapy are best decided by your orthopedic surgeon. And in conditions where there are extreme osteoporosis, like score of -2.5 to -3.5, -4, we also need to give something known as teriparatide hormone injections, which are to be injected on a daily basis. But that is something your doctor will decide. You, my friends, need to take calcium tablets as supplements if you're 40 plus. So if you're 40 plus, I would recommend 1000 to 1500 milligram of calcium every day. Vitamin D supplements. Now, there are two forms which are available in market. Vitamin D as 1000 units, international units, IU, which you can take it on a daily basis. You can take 2000 international units also on a daily basis, but 1000 is sufficient. Or if your vitamin D is normal, then you take vitamin D supplements of 60,000 units once a month for life. But suppose you have done your vitamin D3 test and it is low. I would ask you to go to your doctor and get a prescription for your vitamin D, whether it is in the form of injections or liquids or powders or capsules or tablets. I would suggest not to self-medicate about it. Go to your doctor, see what he would prescribe, and then once your vitamin D comes back to normal, again, you take that 60,000 unit dose once a month. The best way to remember is, I say, you should go to, whenever you pay a salary to your kammali bai, खुशी के मारे एक vitamin D का tablet खा लो. That is as far as vitamin D is concerned. I would recommend you to ask more questions, whatever it is, and in whichever way I will be able to best answer to you, I'll try my best. Right? Please ping your questions on the messenger. I hope I was very loud and clear. Are there any questions? All right. So I think more or less we have no questions. So I think either it's gone a bouncer or I've covered my base everywhere. You're most free to ping a question at any point of time. Great. So I would log out now. At this stage, I would like to thank Ms. Riddhi Doshi and the team Lajja for giving me the opportunity to speak on osteoporosis over here. And I would be more than happy to uh, be speaking further if any orthopedic related questions or topics have to be covered in the future. Thank you so much.